One of the really big changes in the way that we look at spine care and spine surgery over the past 20 years is the use of what's called patient-based outcome measures. So historically, whether a patient did well with surgery was determined by the doctor said you did well or the doctor said you didn't do well, which obviously is not necessarily the best way to look at it. And in medicine in general, in orthopedics in general, but particularly in spine, we've really moved to using the patient's own reports of their improvement in function and improvement in quality of life as the primary metric of the success of an intervention. And while this is true across a lot of orthopedics, spine has really been the leader in utilizing that concentration on the patient in terms of trying to judge the value of different interventions. And actually, that started probably in the early 2000s. And one of the first important interactions was a collaboration with Leatherman Spine Center and VSI, which looked at thresholds for patient outcome measures. So you fill out a survey and it gives you a number, but that number doesn't really reflect an inherent value. When someone says you have an ODI score, an Oswestry disability score of 30, is that good? Is that bad? If you go up 10, is that good or that bad? It's hard to really understand. It's not like looking at a Tiffany necklace or saying something's 14 karat gold, where you inherently understand what that means. So the way people get around that is by developing thresholds that represent the amount of change that firstly patients can recognize as a real change consistently, and then more importantly, looking at the amount of change that patients identify as a major improvement in their symptoms. And those patient metrics, those patient-reported outcomes, have become the currency for how we determine the value of any intervention, of therapy, of injections, of surgery. It's also the tool by which people try to judge economic value. Is a treatment cost-effective? The Leatherman Spine Center has been really integral to coming to understand patient-based outcome measures and how that can be applied. There are elements of that we've done really well. I think that looking at what's important to the patient is really improve the quality of care that we deliver. But there are elements that really still need work. One of the things that I think is really important is patient expectations. So it turns out what the patient anticipates, what they expect to be better after an intervention, really has a significant bearing on how they do, how they regard the treatment that they've received. And that's something that we're trying to study and trying to develop metrics to assess patient expectations. At the moment, that's a focus of some of the research we're doing. Another really important thing is the issue of health literacy. So across a lot of chronic diseases, if you look in diabetes, if you look in cardiac disease, it's been well demonstrated that a patient's understanding of what their doctor says to them, of the medical language, impacts their response to treatment and the effectiveness of treatment. Doctors tend to use big terms as if the patient's simply going to understand that. And a lot of patients will, nod, and you'll get the impression they understand, when in fact that may not be the case. That leads to people taking the wrong medication, the wrong dose, the wrong timing, repetitive treatments. And people have addressed that with techniques like teach back, where you get the patient to repeat back to you what you've tried to explain to them. And while that's been very effective across a range of specialties, that's something that's not really been done at all in spine surgery.